Well, according to my experiences, treating cancer patients daily working in this small-scale laboratory, we see a lot of early-stage lung cancer cases where we analyze these cases by taking tumor cells off to understand genetic heterogeneity, more specifically, the intratumor heterogeneity in this small piece of lesion. Back in 2011, when things like hallmarks of cancer were most likely talked about, it was known that the resistance against cell death is the very basic mechanism of growth and metastasis of tumors. In 2017, we were able to pick up more details about such mechanism. Specifically, in terms of the resistance against cell death, it was known that BH3 mimetics resist cell death most effectively. Of those effects known to be important to induce cell death, effects like BAX and BAC are inhibited by anti-apoptotic molecule such as BCL2, BCLXL, and MCL1. However, existence of BH3 mimetics in the modulators like BIM, BAD, PUMA helps overcome such inhibitory effects. When BH3 domains are observed using X-ray, they are inserted into the hydrophobic grooves of BCL2 family proteins, inhibiting effectors from bonding to anti-apoptotic molecules, and thereby helping effectors to induce apoptosis more freely. Among those BH3 mimetics developed so far, there exists no BH3 mimetics-only single agent used in the clinical settings. Due to the fact that benefits do not exceed risks, adverse events I mean. When risks exceed benefits, an agent cannot be used in the clinical settings, you know. So, we jumped in to do something for BH3 mimetics to be used as a single agent in the clinical settings. Doing so, we're observing how many anti-apoptotic proteins are expressed and how they work. To begin with, let me begin by explaining how cisplatin induces anti-apoptotic proteins. Upon therapeutic use of some of the most common chemicals like cisplatin, substances like BCLXL and BCLW increase dose-dependent and time-dependent. And such increase was known to start from RNA transcript level, as you can see. Now, we're going to talk about how things change in patients without receiving any treatment by analyzing anti-apoptotic molecules in normal tissues and cancer tissues. We've analyzed a total of 12 patients. The result was overexpression of BCLXL and MCL1 in cancer tissues in more than a half of the patients. This result can be normalized by working the same analysis in greater number of patients. Among paraffin-embedded tissues collected out of a total of 117 patients, more than 3/4 of the patients expressed increase in anti-apoptotic molecule at a moderate or higher level. Increase in anti-apoptotic molecule has obvious negative effect against survival. Now, let me tell you the details about the mechanism of such increase is that when we use cisplatin, SRC, JNK, and STAT3 get activated. An activation of JNK slightly inhibits anti-apoptotic molecule from being expressed. When we attempted to inhibit STAT3, increase in anti-apoptotic molecule induced by the effect of cisplatin rather inhibited, meaning that STAT3 works against the cisplatin-induced anti-apoptotic molecule. Now, let's get to the point. Based on what we know out of the legacy studies, we're going to talk about how to avoid increase in anti-apoptotic molecule for improved therapeutic effects. Here, we have a prototype medication, ABT-737, that displays cytochrome C into cytoplasm in mitochondria. As you can see in the confocal microscopic images, treatment with ABT-737 organizes effects like back. More intensively, when used in combination with cisplatin in mitochondria. In the images below, cytoplasm in mitochondria blazes when compared to cytochrome C. As for the adequacy of using the combination I mentioned above, let me talk about the synergy of cisplatin and BH3 mimetics. When H460 cells were treated with cisplatin in combination with ABT, cleaved PARP and activated caspase-3 increased. In terms of quantitative apoptotic pressure, slightly higher apoptotic pressure was observed when cisplatin was used in combination with ABT compared to cisplatin-only treatment. Quantitative analysis using the combination index curve also produced the same result as the combination indices at all combination ratios of cisplatin and ABT-373, 1 to 1, 1 to 0.5, and 2 to 1, were less than 1, meaning cisplatin synergizes with BH3 mimetics. To further verify the synergy beyond the cell level, we've designed an in vivo settings where we used KRAS G12D mouse model. Upon treatments to express lung cancers in 6 months, as you can see in the figure B, the mice were treated with single agents. After that, the tumor size slightly decreased. However, after combined treatment with cisplatin and ABT-373, as you can see in the last panel in the figure B, drastic decrease in tumor size was observed. The stained apoptotic molecules out of the tumor tissues, as you can see in the figure D, also evidenced that statistically significant increase in activated caspase-3 was observed in the combination treatment group compared to other groups. No significant increase in such adverse events at weight loss was observed in the combination treatment group compared to other groups. This means that the combined use of ABT-737 with the conventional treatment performs much better in curing interactable to treat cancers than treatment with single agent like ABT-737.